And joining us now is Dr. Zeke Emanuel, the Vice Provost of Global Initiatives at the University of Pennsylvania and a former member of the Biden Transition COVID-19 Advisory Board. So let me ask you about that. How serious is this threat? Forge vaccination cards so people can go out and do what they want when they have not been vaxxed?
Yeah, I think it's a serious threat. I think it's inevitable, and have been saying it for months, that we will be certifying whether people have been vaccinated or not to go to indoor events like theater or sporting events, or even board airplanes, or return to employment. And I understand why the administration really didn't want to create a large database. I don't think the privacy is really the concern. I think a lot of people are what they're really worried about is things like exploitation. Is it going to be commercialized? Is it going to fall into hands where people are going to use it for other reasons than the reasons that they certified? And I think those are serious concerns. But so is forgery, and so is I'm going to an indoor spot. Everyone says that they've been vaccinated, show their card, but in fact haven't, and a spreading event is possible. So there's no easy solution here, but I do think not doing a national database whereby the QR code you can actually get in, having that be done by a not-for-profit, making sure it won't be commercialized, I think that would have been the right way to go.
And also, Craig Melvin talked to the president, of course, about whether the military should have to get vaccinated. I want to show that response.
Will you order service members to get the COVID vaccine?
I don't know. I'm going to leave that to the military.
Well, why not?
Well, I'm not saying I won't. I think it's going to be a tough call as to whether or not they should be required to have to get it in the military, because you're such close proximity with other military personnel.
Especially in naval quarters, they've already had problems on ships with spread. Should members of the military have to be vaccinated?
You know, Andrea, about 3 weeks ago now, we published an op-ed in the New York Times saying that we really are going to need mandates to get up to herd immunity. I think the place you start with mandates are healthcare workers. Healthcare workers are professionals who pledge that they're going to put their patients first, and all healthcare workers should be mandated to get this vaccine. Many healthcare facilities already mandate that their workers have to get a flu vaccine. COVID is a much more serious illness, and it seems to me that's the place to start. And then we can think about policemen and first responders, EMTs. Employers, I think, need to think about this. So I think it's really important. And I am chagrined that, some polls have suggested that 40% of different parts of the military have refused. That is a very serious concern. The last thing we want are super spreading events among our soldiers when the world is tense. We have tense relations with Iran, tense relations at the moment in the South China Sea, or in the straits between Taiwan and China. I mean, we have to be prepared, and our military has to be prepared. No one likes to put in a mandate. On the other hand, no one likes to see people come down with this illness, get hospitalized, and God forbid, die.
But you already had an aircraft carrier that was, stuck in port and quarantined for quite some time back, I guess, more than a year ago. The CDC says now that they have received reports of clusters of 64 anxiety-related events after the administration paused, of course, on the Johnson & Johnson vaccine from those 5 mass vaccination sites now in different states. About J&J and anxiety.
No, I think they're, minor reports. We've given out millions of doses of the J&J vaccine. This is clearly a response to the heightened tension around them. But I don't think they're that serious. I mean, they're fainting, they're sweating, they're increased heart rates. I would not put too much stock in this. And I think as the J&J vaccine comes back to common use, you're seeing a lot of people want it. They like the one and done part of it. And I think, it provides an alternative.
Was it a mistake to do the pause, Zeke?
It wasn't what I would have done. I think the main goals the government wanted to get inform doctors about the right treatment of this and make them aware that this was a problem. See if there were additional cases out there. Very, very important, and examine the data. I think all of that could have been done without a pause or with a much more targeted pause. And we could have calculated on day one that even if we had 10 times the number of reports as were discovered through the reporting system, it still would have meant that it was overwhelmingly beneficial to get the vaccine, even with this side effect. And so I worried about it right from the start.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.